This is Dr. Troell talking about facial implants, the technique, what to expect, post-op healing. So most of the time we put these implants in under oral sedation. Sometimes we add intravenous sedation. Rarely do we need to do it under general anesthesia. The only implant that we need to do it under general anesthesia when we're putting angle of mandible or total mandibular implant. When we put the implant in, oral sedation, we do nerve blocks to knock out the nerve so it doesn't hurt, and local anesthesia to prevent any bleeding. So many of these dissections, we don't even need anything to stop bleeding because there's virtually no bleeding in the surgical field. So beforehand, no aspirin, no fish oil for 10 to 14 days, no Motrin, ibuprofen for 5 days, no alcohol for 48 hours. All those things increase the risk of bruising or bleeding. Beforehand, really only one lab test if you're healthy called a CBC. When we're done with the surgery, classically people have cold compresses to their face, frozen corn in a Ziploc bag. That decreases swelling. We want you to do that for the first 2 to 3 days. Besides that, if we made an incision inside your mouth, classically to put this implant in, the incision is 1 centimeter, which is about 1/4 inch. We put some absorbable sutures, absorb by themselves, no external incision. You might get some bruising. If you do get bruising, it's usually up near the eye area, rarely down here. And main thing is swelling. Most of the incisions on all the implants are hard to see. There's some that are inside your mouth. The temporal implant could be either next to your ear, behind your hairline. When we do it with a facelift, it's where the facelift incision is. So if we're going to put one in the tear trough, it's either below your eyelashes or inside the eye. So all the incisions are hard to see. So these procedures that can be done, again, under local, conscious sedation, or general anesthesia. The recovery is pretty quick. The pain is only for 1 to 2 days of needing narcotics, and the overall care afterwards is negligible. If we have an incision inside your mouth, it's just gargling after each meal and before you go to sleep. If we have an external incision, such as below your eye or into your temporal fossa, antibiotic ointment 3 or 4 times a day. So most people, if we do the procedures, can return to work anywhere between 2 to 5 days after the procedure. If they don't mind having an incision or a little bit of swelling and bruising, they can return sooner. So facial implants are the advantages. They're, in most cases, the best technique for that specific issue. Why most doctors don't refer them, patients, to implant is they don't have the education and training to put these in. Since I teach for Implant Tech, the largest facial implant company in the world, and I've been doing that since 2015, we have the advantage of offering all techniques to patients, including fillers, both temporary and permanent, fat transfer, and implants. If you want to know more information, please contact my office by email or phone.